Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
My name is Matt Delvecchio, specializing in life transitions, downsizing, and the senior living industry. Today, February 4th, is World Cancer Day. We're going to continue our show highlighting our fight against cancer. And earlier we heard about an award-winning app, and we also heard from Julie Canville, the president of the MUHC Foundation. Now, I'd like to talk about the medical side of cancer, the men and women making a difference in saving lives and improving our quality of life. I'd like to bring in Dr. Sarkis Meterissian, a surgical oncologist and the director of the MUHC's Breast Cancer Clinic. Dr. Meterissian, welcome to Life Unrehearsed. Okay, we've just had him and we just got a disconnection. We're going to try to get him back on the line. Breast cancer as part of this World Cancer Day that's one of the things I wanted to bring up in today's show. So prevalent, things are improving, but let's face it. Most of us have either had a family member affected by breast cancer or we know of someone affected by it. It's estimated that about 1 in 8 Canadian women will develop breast cancer during her lifetime, and 1 in 31 will die from it. Breast cancer is the most common cancer among Canadian women, excluding non-melanoma skin cancers, and it's the second leading cause of death from cancer in Canadian women. We've talked about women. Breast cancer also affects men as well. Obviously not as much, but believe it or not, in 2022, 270 Canadian men were diagnosed with breast cancer, and actually 55 men have died from breast cancer. So it just isn't a woman issue, but by far it does affect women. And not only does it affect individuals, as we've talked about on today's show, with any form of cancer, it affects families as well. And when we're still trying to get Dr. Meterissian on the line. He's been so involved with the improvement in terms of research. He was also the founder in 2012 of the MUHC's Breast Clinic's Wellness Program in 2012. And the concept behind that is, okay, there's the individual affected by breast cancer, but it is also with the families as well, and we need to support it. It may affect the individual, but you talk about direct families. We're talking moms here, we're talking daughters and sisters, and everyone is concerned when someone is affected by breast cancer. One of the interesting statistics that when I was looking this up, that in 1986 was the peak of breast cancer, and it has been declining since then. It is quite amazing because it is still very prevalent. We're still seeing it, but it has been declining since 1986, which is very, very encouraging. I also, in a way, compared a little bit on the men's side of things with prostate cancer. You think about prostate cancer 20, 30 years ago, it was almost an automatic death sentence, and things have improved. And this is why we wanted to bring this to the show today on World Cancer Day, because the donations, we just heard it from Julie Canville, the president of the MUHC Foundation. These donations help, and we're seeing advancements. And part of the reasons for the advancements of breast cancers, primarily, it is due to screening. Screening technology has improved, and I think understanding being able to do self-tests and breast examinations and the importance of screening, that has been one of the big reasons for the decline in breast cancer, even though it is still, as you heard, 1 in 8 Canadian women will still get affected. But the death rates are improving in terms of ratios. The other reason for breast cancer improving has a lot to do with the treatments. And, Dr. Meterissian is on the forefront of treatments and research in dealing with breast cancer, and it is not so invasive as it was many, many years ago. And so as we continue with these improvements, we still have a very, very long ways to go concerning breast cancer. And I believe we've got Dr. Meterissian back on the line. Dr. Meterissian, are you there?
I'm here.
Okay, good. Welcome to Life Unrehearsed. And I really appreciate you taking, you're obviously a very busy man. I was singing your praises, Dr. Meterissian, because you have done so much, not just for the Montreal community and individuals affected with breast cancer, but their families as well. And I was talking about the creation of the clinical wellness program way back in 2012. Now, let's get right into it, Dr. Meterissian. What are some of the signs and symptoms that women should be looking for?
Well, the obvious symptoms are, for example, just observing their breasts and noticing that their nipples have become retracted, or there's dimpling of the skin, or there's some redness in the skin. Now, the first two are really important, the retraction of the nipple and the skin dimpling. Nipple discharge is something that they should bring to the attention of their family doctor. And although more and more we're encouraging women, in fact, not to examine their breasts, but more to observe their breasts. But of course, if they ever feel a lump, well, they should then right away consult a physician.
All right, you're listening to Life Unrehearsed, and that's Dr. Sarkis Meterissian. He's a surgical oncologist and the director of the MUHC's Breast Cancer Clinic. Dr. Meterissian, I mentioned briefly before you got on air that the peak of breast cancer death rates was in 1986, and it's been declining since. It's obviously still very prevalent, but what are some of the major reasons for that decline?
Well, the major reason has been the advances we've made in diagnosis and as well as medical treatment. So since the 90s and, of course, the late 90s, early 2000s, screening programs have been put in place. Women are going for screening mammography. They're getting their cancers detected at an earlier stage and a more curable stage. So that's number one. And then number two is we've made significant advances in treating the breast cancers. Now, the surgery has gotten better, but apart from the surgery, we've gotten better medical treatments. Chemotherapy has improved. The anti-hormone therapies have improved. So now a woman who gets diagnosed in 2023 can look at a 90% chance of being cured at least.
Amazing stats. Who would have thought that, just even 10, 15 years ago? That's Dr. Sarkis Meterissian, surgical oncologist and the director of the MUHC's Breast Cancer Clinic. We're quickly running out of time. I was going to say slowly, quickly running out of time, Doctor. But I wanted to get your input. You're so involved also in some of the latest research on breast cancer. And can you tell us what the medical field is seeing regarding the latest research?
Well, let me just tell you that because of your shorter time, but I just wanted to say the major areas of research is in the molecular biology of breast cancer, understanding how breast cancer cells grow and metastasize, and developing drugs. And the drugs are coming down the pipeline. So women are being treated today far differently than they were treated even 3 to 4 years ago with newer agents and more effective agents. And then the second thing is that we have better ways of following women who are being treated. The ability to detect cancer cells in blood and DNA in blood, and we'll be able then to follow treated and be better able to predict if they respond to treatment and if they're being cured, because we'll look at the cancer cells in their blood, and if they disappear, well, we'll know that the treatments are working. So it's very exciting stuff that we never thought we could do, but now it's come to the molecular level, and it's going to even get more exciting in the next 5 to 10 years.
Well, so encouraging to hear, and all the reason, all the dollars being donated, and today, you're with the MUHC, and every dollar does count. Dr. Meterissian, we want to thank you for joining us here on Life Unrehearsed.
Well, thank you very much, Matt. I appreciate it.
All right. That's Dr. Sarkis Meterissian, a surgical oncologist and the director of the MUHC's Breast Cancer Clinic. Coming right up, an inspiring man fighting his way through throat cancer, yet still giving back through several important causes. We're going to hear from Eddie Nolan. That's going to come up next after the CJD Traffic Center update with Jill Fitzgerald.